Are you curious if you've got endometriosis? You've probably heard of common symptoms like pain with periods or pain with intercourse, but there are many different ways that endometriosis can show up. Today, we're going to go over the many symptoms of endometriosis so you can learn more and learn how to advocate for your own care, figure out if you've got endometriosis. I'm Dr. Laura Shaheen. I'm a double board certified OBGYN and reproductive endocrinologist, helping people build families and deal and treat and diagnose endometriosis for almost 20 years. If this is your first time finding the channel, welcome. I love educating. Be sure and subscribe to this channel so you get my weekly videos all about reproductive health. Two more ways to stay in touch with me and learn is my weekly podcast, the Baby or Bust Fertility Podcast. You can listen anywhere you listen to podcasts and sign up for my newsletter. I'll put a link in the notes below so you can get my weekly newsletter with up-to-date news and fertility content and education I'm sharing that week, and my weekly recommendations on books and other resources that I love and I want to share with you. If you are wondering if you've got endometriosis, you are in the right place. Today, we're going to go over 5 main topics. Topic number 1, we're going to do a review of exactly what endometriosis is. Number 2, we're going to review the common symptoms of endometriosis. Number 3, we're going to go over the uncommon symptoms of endometriosis, things that you might not even be aware that can be a sign that you might have this chronic disease. Topic number 4, we're going to go over why endometriosis is more than just a fertility diagnosis, and it's something that you should care about throughout your lifetime, whether or not you want to have a family. Topic number 5, we're going to go over a brief review of treatment options and relief of these symptoms. And stick around to the end of this video where I'm going to give you top 3 questions to ask your doctor about endometriosis. Topic number 1, what is endometriosis? Endometriosis is a chronic inflammatory disorder or disease in which tissue that looks just like that which should be found on the inner lining of the uterine cavity is found outside of the uterus. This tissue can be found on the outside of the uterus, on the ovaries, on the fallopian tubes. It can be throughout the pelvis and abdominal cavity. That's what we think about the most. But this tissue has been found all over the body. We have case reports where endometriosis has been found in lungs, and there's 3 reports in the medical literature of endometriosis being found in the brain. We still have a lot to learn about endometriosis, and we are working hard in the field to help understand more about why some people get endometriosis and some people don't, why some people have symptoms and some people don't. And we're learning more every single day, but in general, this is what endometriosis is. I have a playlist here about endometriosis where you can learn a little bit more about exactly what it is, and especially how fertility can be impacted for people who have endometriosis, but not always. Topic number 2, common symptoms of endometriosis: pain. Pain. So painful periods, pain with intercourse, and then pain associated with bowel changes and urinary changes. But the most common red flag that somebody has endometriosis is pain that usually fluctuates with the cycle. And so when those lesions are inflamed around the time of the menstrual period and hormones are changing, that inflammation, the swelling of the lesion, sometimes they even bleed a little bit, and that can be very irritating to the inside of the pelvis and abdominal wall and organs. Pain, that is the most common presentation of endometriosis, and it should be a red flag. Now, not everybody with endometriosis gets pain, so you can't say, oh, you don't have pain with your periods, you must not have endometriosis. There is silent endometriosis, but if you said to me, hey, what is the most common red flag or symptom of endometriosis, it would be pain, and it's usually associated around the period and the hormone changes that happen with the period, but people can have symptoms throughout their menstrual cycle. Now, I got to talk about gaslighting with period pain. The average time from onset of symptoms to diagnosis of endometriosis is 7 to 8 years. There's many reasons for this, Part of it is because so many people are dismissed when they try to talk to loved ones, their doctors, their healthcare team about their period pain. And people will say to them, everybody gets pain with periods, just suck it up. It's just a part of being a woman. It's just a part of getting periods. We just have to deal with it. The only way to truly diagnose endometriosis is seeing the lesions. So, a laparoscopy in which a little camera is put through the belly button so you can see the lesions, gather a sample, look at it under the microscope. And so, requiring that as a diagnosis and the combining with dismissing pain as just a natural part of being a human who gets periods um, leads to delay in diagnosis. And so sometimes patients won't even bring it up anymore because they've brought it up at multiple doctor's visits and have always been said like, oh, okay, whatever, that's just you. But if you are having pain that is disrupting activities in your life, pain that you can't go to school, you can't go to work, you're missing activities that you enjoy because you're having pain. I've had patients say, oh yeah, I pass out pretty regularly a couple times a year with the pain with my periods, or I just know I'm going to miss a day or two of work when my period is coming. That is not okay. We should not just blow that off. You need to find someone that listens to you. But I just want to explain the many reasons why this is just a frustrating situation for so many people. And I hope that you find the right doctor that listens to you and helps you figure this out. Topic number 3, the uncommon symptoms of endometriosis. Talked a lot about pain, but there's 7 other symptoms that I think of, I ask about, and patients should be aware of that can be suggestive of endometriosis. The hard part about these 7 symptoms is that they can also be caused by many different things. And so you're kind of putting this puzzle piece together. You're listening to your own instincts. You're finding a healthcare provider that listens to you. But let's talk about these 7 uncommon symptoms of endometriosis that you might want to think about. Number 1, abdominal bloating and changes in your bowel habits around the time of your period. So sometimes endometriosis lesions can be on the intestines, the large intestines, the rectum. And when those lesions get inflamed, people can have changes in their bowel habits and even pain with bowel movements. That can also lead to abdominal bloating, feeling gassy, just a lot of abdominal complaints. Symptom number 2, fatigue. This is deep exhaustion and fatigue. Of course, they can be caused by many different things, but it's something that can be associated with endometriosis. Symptom number 3, urinary symptoms, especially frequency, like having to go to the bathroom a lot, getting up at night to go to the bathroom a lot, pain with urination, and a lot of these changes with urination happening around the time of your period when the hormones are changing and causing these endometriosis lesions that are on the bladder to be inflamed. Symptom number 4 is cysts on the ovaries. Now, cyst just means a fluid-filled structure, and actually ovaries are dynamic, and every month that we ovulate an egg, we actually create a cyst. That particular cyst is called a follicle, which is a fluid-filled structure within the ovary that has the egg, and the egg releases from that fluid-filled structure for ovulation. And then that follicle or cyst goes away. But there can be growths of endometriosis that are within the ovary that have a specific appearance about them. They kind of have this shaded gray, it's often called ground glass appearance, and it's a persistent cyst or collection of endometriosis on the ovaries. Now, I have a video here that talks all about ovarian cysts, and you can take a look at that and learn more about the different types of cysts. And just because you have a cyst on your ovary, that does not mean that you have endometriosis. And just because you don't have a cyst or any finding on imaging for endometriosis is not perfect. And I'm just saying that if you're having symptoms of pain and with a pelvic ultrasound, you see a structure, a cyst that looks like an endometrioma on the ovaries, that is a great clue and sign and possible symptom of endometriosis. Symptom number 5, period changes. This could be really heavy flow. Of course, there can be other reasons that people have heavy periods, but endometriosis can be one of them. And then you can also have spotting in between your period, especially after ovulation, before you get your next period. I've often had patients say, oh yeah, I always spot for a couple of days before I get my full flow. Of course, there are other things. I'm not saying that This one symptom means that you have endometriosis, but it's just something that comes up a lot, and a lot of it has to do with the hormonal changes. Symptom number 6, nerve pain. So, pain that is shooting into the back, into the groin, going down your leg, especially during the period. This can be nerve inflammation from the endometriosis lesions kind of being close to nerves that are innervating the rest of our body. And symptom number 7, depression and anxiety. So there's lots of reasons why these two things could be associated. If you're suffering from pain and people do not believe your symptoms and you are dealing with chronic fatigue, chronic pain, missing activities you enjoy, that can absolutely be a trigger for depression and anxiety, or it could be independently related. But this is something that a lot of people with endometriosis are also struggling with, and it's important to always pay attention to your mental health. One study out of Yale, it's a population-based study with 8,000 patients with endometriosis compared to 200,000 patients without endometriosis, and looking at incidence of mental health issues. And the patients with endometriosis had a higher risk for depression and anxiety. Topic number 4, endometriosis is not just about fertility. I do think that it comes up a lot when we're thinking about fertility or trying to have a baby. And sometimes endometriosis can be associated with infertility, but only about 50% of the time, people with diagnosed endometriosis also have difficulty getting pregnant. But I think this link for fertility exists for a lot of reasons. I think as a fertility doctor, I am often the person who is diagnosing endometriosis. And part of it can be that it's a red flag for me. Like, I'm thinking about it, I'm asking questions about it. I'm really, asking for deeper answers from my patients. And I know that they want to conceive, and I want to make sure that I'm not missing an endometriosis diagnosis as a part of their situation. Another thing is that when people are trying to conceive, they usually stop birth control because they're trying to conceive. And often people with endometriosis and they've had period changes, they've had pain with periods, et cetera, they're often given hormonal birth control or a hormonal IUD in order to help relieve the symptoms of painful periods or irregular bleeding and heavy bleeding. And then when they stop this hormonal treatment, pain starts to come back, symptoms start to come back. And so if you're starting to have symptoms after stopping hormonal birth control, like birth control pills or a hormonal IUD, periods are getting more painful, periods are starting to get heavier, spotting is happening, that should be a red flag, and ask the question, hey, could I possibly have endometriosis? Regardless of whether or not you want to grow your family or have a baby, it's important to know if you have endometriosis or not. But I just see this link. I think fertility doctors are more in tune and thinking about it. And it often comes up and is diagnosed during a fertility evaluation for multiple different reasons. Topic number 5, a brief review of treatment. So if someone is having symptoms from endometriosis, first of all, you need to make sure that the symptoms aren't from something else. So a lot of the things that I described could be from endometriosis and they could be from something else. For example, heavy periods could be from fibroids. So you need to have imaging and anatomy evaluation to make sure that's not a cause of the heavy bleeding. The abdominal symptoms could certainly be something like irritable bowel syndrome or inflammation within the bowels, or other reasons that people can have bowel issues. It's not absolutely always associated with endometriosis. Treatment options for endometriosis, if you've ruled out other causes for these symptoms and we really think it's endometriosis, are either medical treatments or surgical treatments. And surgical treatment is actually can be both diagnostic and treat the pain, especially associated with endometriosis. So if you do surgery with a pelvic specialist, someone that does excisional surgery for the lesions, I have seen dramatic changes in pain, symptoms, activity levels, just dramatic changes in someone's whole life if they have a really good outcome from their surgery. You have to be very careful about who you're asking to do the surgery and get a lot of information from that surgeon. But I've seen it be absolutely life-changing. Surgery can be nerve-wracking for some people. A lot of people don't want to think about that like a first-line treatment. And so oftentimes they'll think about medical treatment. And medical treatment of endometriosis is trying to quiet the inflammation. And the best thing that we have for that, honestly, is progesterone. Of course, there are other options that are out there, and talk to your doctor about what options are there. But in general, progesterone quiets the inflammation from endometriosis, where estrogen sort of builds up and can make the symptoms be inflamed. And so birth control pills are very common to provide for someone, and it can really help with symptoms. Progesterone IUD can often be helpful. For my patients that are trying to get pregnant, medical treatment like that is not helpful. We're really thinking about how that person can get pregnant as soon as possible, because that is their goal, and then figuring out how to help them after they deliver for long-term symptom relief. Now, I'm glad you stuck around to the end of the video, because I want to share 3 things to talk to your doctor about if you think you might have endometriosis. Number 1, state clearly that you think you might have endometriosis. Like, lead the doctor to the diagnosis. Sometimes I think patients can be passive, or they worry that they're kind of, doing too much as a patient, like advocating too much, like they don't want to, there's a power dynamic between the doctor and patient. I feel like it should be a team effort, of course, but sometimes there's a power dynamic. And so sometimes people will kind of tiptoe around it, but just be honest, be like, hey, I'm having some symptoms and I'm really curious if I have endometriosis, so that that doctor can be like, oh, okay, like let's figure this out. That's what this person is thinking about. Whereas you kind of say, hey, I'm having this and this and this and this and all these different symptoms. It can sometimes just take a little bit longer to get to the direct questions that you're trying to get answered. Number 2, review the symptoms. Write them down. So go back and listen to this video again if it helps you. Write down the symptoms that I talk about and track them over a couple of months and see if that's happening to you. And you can say, hey, I've had really painful periods since going off the birth control pill. They're getting worse and worse. Now I'm starting to have spotting. I'm having some diarrhea during my periods. And maybe you don't have all of these things. Maybe you just have 1 or 2 things, but you can kind of track it and sort of see, and just really be equipped and have notes with you to sort of say, this is happening. This is what I'm seeing. These are the symptoms that I'm having. And then number 3, how are we going to figure this out? You and the doctor or the healthcare provider are on the same team. You're trying to figure out if endometriosis is causing these symptoms, and talk about how you're going to do that together. What tests are you going to do to rule out this issue, or this diagnostic test or laparoscopy to figure out if you do have endometriosis? Come up with a plan, talk about your next steps, and figure out how you're going to get future questions answered. So that's actually more than 3 things, but I just think it's really important to go to that appointment with like a solid goal, things written down, and take notes, because it can be so easy to get sidetracked, and you really, really want to get your questions answered. I hope you enjoyed this video. Like this video if you learned something, comment with questions that you have. Be sure and subscribe to this channel so you get my weekly video all about reproductive health. Make sure and look in the link below to sign up for my newsletter so we can stay in touch every week. And until next week, wishing you love, luck, and pineapples.